Dr. Lewis with Spinal Health and Nutrition. Today, we're going to talk about a very serious topic. It is called stroke. Okay, it is called stroke. And it's affecting over 100 million people, actually 15 million each year over the age of 25. This is a very serious condition. It's not called for any chiropractic care. It's called for immediate medical attention. Okay, so what is a stroke? A stroke is also known as a brain attack or a cerebral vascular attack. That is when the brain receives a lack of blood flow, which will cause damage to the brain cells, and it will eventually lead to personal damage or death. Okay. Now, there are three types of stroke. We have ischemic stroke. That comes from complete blockage of the vessels, the blood vessels. We have hemorrhagic stroke. That comes from when the blood vessels rupture and there's internal bleeding along the brain. And then we have transient ischemic attack, also known as TIA. That's due to a temporary blockage on amongst the blood vessels. That's also known as a mini stroke. Some people have several episodes of a mini stroke, but I consider that as a warning sign. If it's not addressed early, it can lead to a serious stroke. Okay. Now, there are multiple causes of a stroke. There used to be a time when I think that a stroke just comes from hypertension. If hypertension is not dealt with, it will lead to a stroke. But there are also multiple other things that can trigger a stroke. Okay. And if we know that we have a potential to catch a stroke or get a stroke, we definitely have to do some lifestyle changes to our diet, changes with our level of activity. If we're not active, we have to start getting active to get that blood flow going so that our brains can receive that oxygenated blood that it needs. Okay. So let's talk about the first cause of a stroke, okay? But before I go into that, let me show you this. This is the model of the brain. This is the model of the brain, okay? Now, a stroke definitely affects the cerebral portion of the brain, okay? We have the right hemisphere and the left hemisphere. Usually, if someone has a stroke, it affects one side of their body, the right side or the left side. If it affects the right side of the brain, they'll have issues on the left side. If it's the left side of the brain, then they will have issues on the right side, okay? And I'm eventually want to go into the symptoms of that. But let's get to the cause. The first cause is smoking. Smoking will definitely lead to a stroke, okay? Now, several of these causes can do two things. It can even cause blockage in the blood vessels or rupture the blood vessels, okay? It can do one or two things, okay? Now, smoking, this is how smoking causes strokes. It can damage the lining of the blood vessels, which will cause the blood cells to stick to the walls of the arteries, and that will lead to blockage inside the walls of the arteries, and the brain cannot get enough oxygenated blood that it needs, and that will lead to some serious problems. Okay, there are also chemicals in cigarettes that will increase platelets. All right, now platelets are definitely in our bloodstream for a clotting factor. But if we have too much platelets in the bloodstream, that will increase the clotting factor, and that can lead to blockage in the arteries, okay? Another thing that can cause it is high cholesterol. High cholesterol that comes from fast foods, processed foods, okay? And we definitely have to be mindful or cognizant of the type of oil that we use. If we always frying our foods or cooking our foods using vegetable oil, that's not good, because vegetable oils has a high amount of polyunsaturated fats. Those polyunsaturated fats can cause clotting in the blood vessels, okay? And remember this, whenever we buy snacks, I don't care if it's healthy snacks, it's very important for us to look at the amount of saturated fats in the type of foods that we eat, okay? If the saturated fats contains more than 5 grams per 100 grams of saturated fat, that is considered high, okay? So we have to be mindful of the type of oil that we use. Okay, I'm going to get into the type of oil that we need that will help reduce the potential of getting a stroke, and it will also help alleviate the clots in the blood vessels and lower the cholesterol. Okay. Another thing that can cause it, diabetes. All right. Diabetes is a complicated disease. It can cause so many things. It can cause heart disease. It can cause strokes. It can cause infections on the skin, visual problems, all types of problems. Okay. It's very complicated. You're going to notice that each topic, I may mention diabetes because it can cause so many things. All right. So with diabetes, that can lead to an increase in blood sugar or glucose in the bloodstream. When there's a high amount of glucose in the bloodstream, all that blood sugar, that high level of glucose can damage the lining of the vessels, and that will lead to blood clots. All right. Okay. So now let's move on to the hemorrhagic stroke. Okay. That's when we have the internal bleeding along the brain. All right. Now, anyone can get this, even if we're living a healthy lifestyle, having a good diet, exercise, anyone can get this if we're not careful, because one of the things that can cause a hemorrhagic stroke is head trauma. All right. Slip and falls, I deal with at the office 99.9%. Auto accidents, someone get rear in it, their head goes forward, they hit their head on the steering wheel. That can lead to some internal bleeding on the brain, and that can also cause a stroke as well, stroke symptoms. Okay. And as we know, another thing that can do it is hypertension, increasing blood pressure. When that blood pressure is high, the amount of pressure can weaken the walls of the arteries. And when those walls of the arteries rupture, that can also cause internal bleeding on the brain. All right. Bleeding disorders. If we have bleeding disorders, we must stay in contact with our primary care doctor. All right. That's when the body has an inability to clot blood, leading to internal bleeding on the brain. Okay. So if we are taking any medication, follow those medications, follow the dosage of those medications. Don't take too much, don't take too little. Okay. And that can fall into family history. Have a family history of bleeding disorders, and you know that you have it. Keep in mind that can put you at risk of a stroke. All right. So definitely take the recommended medication that is prescribed by your primary care doctor. Okay. Blood thinners. There are certain medications that can cause a rupture of the blood vessels. We have to read or do our research on these blood thinners. Okay. If it has a potential for certain chemicals and ingredients in there that can rupture the blood vessels, please consult with your primary care doctor. All right. Ask them questions about these blood thinners. Follow the correct dosage. Because if you take too much of that stuff, it will put you at risk of a stroke. Okay. Now remember, like I said before, some of the causes of a stroke can either do two things: block the arteries or rupture or break the arteries. And I'm going to mention again, smoking came up on the list again. It can do two things: block it or rupture it. All right. Because with smoking, once again, those chemicals in the cigarettes can increase the platelets, and those platelets can either clot the blood or cause damage to the walls of the artery. And here's one more thing I want to mention that's going to cause it. And this is something that everyone is probably going through right now from all the changes going on, especially people losing their jobs. And that is chronic stress. Chronic stress can definitely do it. Okay. I had a patient that I was treating before. She told me that she suffered with a stroke. I asked her, did she have issues with blood pressure? She said no. I said, did she have issues with diabetes? She said no. I was just stressed out. My job was very stressful. It led to a stroke. But here's the thing, which stress can lead to hypertension. With hypertension, once again, that can affect the walls and arteries, causing the rupture or break. And then that can lead to some internal bleeding on the brain. All right. Now let's go to this one. TIA, transient ischemic attack. I consider this as a warning sign. Okay. If you are having a mini stroke, you must take this seriously. okay? Because if not, that can lead to a serious stroke that can cause permanent damage on the brain cells, and it can lead to death, okay? Listen, we need our brain. We need our brain because these brains are like the headquarters of everything else. It controls how we function. It controls our movement. It controls our speech. It controls our decision making. Having a stroke can cause a serious life-changing experience, okay? We want to make changes for the better, not for the worse, okay? Imagine suffering from a stroke and the aftermath of that. You still have to put up with all these symptoms. You're not as mentally sharp as you were before. Your momentum is not as good as it was before. It's just a lot of changes that's going to take place with the aftermath of the stroke, okay? So we got to keep that in mind, all right? But with the TIA, they can come from obesity, when we get too much fat surrounding the heart, and that can put a lot of pressure on the blood vessels. Here we go again, smoking. Smoking can do it as well, okay? High blood pressure, diabetes, and once again, poor diet, okay? Now, I'm gonna give you the symptoms. The symptoms are numbness or weakness on one side of the body. Remember, if it affects the right side of the brain, you will have some signs and symptoms on the left side. If it's the left side of the brain, signs and symptoms on the right side, okay? So numbness, weakness on one side of the body, difficulty speaking, because the cerebral part of our brains controls our speech and also our movement. Visual problems, okay? Depending on where the clotting and internal bleeding takes place. All right, so the back of the brain here is called the occipital lobe. The occipital lobe is what controls our vision. So any type of damage back here can affect our vision, causing visual impairment. Sudden and severe headaches, okay, especially if there's internal bleeding on the brain. The more fluid that we have on the brain, the more pressure, and it can cause those severe headaches. Dizziness or loss of balance, okay, because underneath here we have the cerebellum. The cerebellum is what controls our balance, okay, movement, okay. So if we're all balanced, we have other signs and symptoms. All right, those are signs and symptoms of a stroke. Please do not seek chiropractic care. You have any signs and symptoms. This is immediate medical attention. Go see a primary care doctor. Go to the emergency room. Okay, this is serious. All right. Now, what are the treatments? We must get a complete cardiovascular screening. Okay, if we go get a complete cardiovascular screening, they use these devices there that will help reveal what's happening with our blood vessels. Help the doctors be able to see if there's accurate blood flow going on. It helps the doctors also be able to see if there's any plaquing build up on the artery, especially with the carotid artery, okay? Whenever there's some type of blockage on the carotid artery or minor blockage, this is where the blood flow goes. It goes up to the brain. But if there's a blockage of oxygenated blood to the brain, that can cause serious problems. That can lead to a stroke and damage of the brain cells, okay? So you must get a complete screening done, all right? Early treatments, including medications and procedures to help minimize brain damage. All right, we have to take that seriously, okay? And they also have stroke rehabilitations to restore the loss of skill and function, okay? But definitely, once again, lifestyle changes, exercises, changing the type of oil that we use, okay? We must use, this is pretty good, use avocado oil, but avocado oil is very expensive. This is a pretty good oil here too. This is extra virgin olive oil, okay? This olive oil has polyphenols in there. It has antioxidants in there that will help reduce our LDLs, which is the low density protein, and also increase the HDLs, which is the high density protein, okay? We can use this as well, all right? Now, this here is a very rich type of polyphenol-rich olive oil, okay? If you have any issues with your cholesterol, you know that you're having some signs of a minor stroke, the doctor said that you're having a minor stroke, you can take this as well. 1 or 2 teaspoons a day, very rich. This is not diluted with other chemicals. This is straight, cold-pressed polyphenol olive oil. Take 1 or 2 teaspoons of this a day. that will also help reduce clotting, plaque in the blood vessels. LDLs will be decreased, HDLs will increase, okay? And remember, please do at least 30 or 40 minutes of some sort of physical activity a day. You have to keep that blood flowing so the brain get the oxygenated blood that it needs. All right. Okay, I'm Dr. Lewis. Please share and subscribe to our YouTube channel. And remember, your health is your greatest investment.